Okay, so we are live, I believe. But I still have people in the waiting room, so let me admit those and then we can start. Okay, hello everybody. Thank you for coming to this webinar. My name is Stephen Brooks. I'm a Special Projects Coordinator with the Department of Behavioral Health Services. And in recognition of May Mental Health Month, we're hosting a weekly web-based opportunity to meet some of the community providers and that use the behavioral health dollars and to create safety nets for the community, for Albuquerque and for Bernalillo County, and provide various behavioral health supports to the community. Today we are joined by leaders who provide the housing supports in Bernalillo County. You know, the organizations that we're going to that are going to present to you, they help us ensure that individuals with behavioral health needs are provided stable housing. And our goal with this series of webinars is to give the community an opportunity to learn about a lot of the great work, really tremendous work that these providers do at the community level, and how supports from BHI are helping that effort. So the first presenter, please join me in welcoming. First presenter is Trisha Nogales, and Trisha is an independently licensed clinical supervisor with Youth Development Incorporated, YDI. And Trisha is going to give us a brief overview of YDI and program information on YDI's Youth Transitional Living Services Program, or YTLS is what we call it. The name of Trisha's program that she's going to talk about is Independent Futures. She'll also share information on other programs within YDI that Independent Futures supports or is supported by them, because YDI has a lot of really good services that really work together very well. So go ahead, Trish, and take it away.
All right, good morning. My name is Trisha Nogales. I'm a clinical supervisor here at YDI. Are we going through the slides, Stephen? Sorry.
Yes, ma'am. And you tell me when you want me to.
Okay, you can start with the first one. Yeah, go ahead.
Okay. Is it not? There we go.
Oh, that's Crossroads.
Yeah, that is Crossroads. Let's do this. Let's go to.
Okay. You can go to the next one.
We'll go back. Okay.
All right. So Independent Futures, we're an outpatient transitional living service. So what we do is we meet with youth where they currently are. We work with homeless and precariously housed youth. That could mean that they are staying on the streets, they're couch surfing, they're staying from hotel to hotel, shelter to shelter. They don't really have any stable, safe housing. We work with ages 16 to 24. They do have to be staying within Bernalillo County. They do have to be homeless, at risk of homelessness, or precariously housed, as we previously shared. Go ahead and change that to the next slide. We can help by providing therapy services to the youth that are in Independent Futures. We can also do case management, which is money management, finding stable housing, employment and education, teach them life skills, crisis stabilization. We do individualized service plans and provide additional support and referrals for other services. Our case managers go to our youth wherever they may be. They work with them in their environment. They work with them in the offices, out in the community, in the streets, in the schools, pretty much wherever they are that we can assist and help. With COVID right now, we are taking precautions, but we're starting to get back out there in the community and meet with our youth one-on-one again. Next slide. So we're able to link to a lot of services within YDI. Some of our main ones are going to be our crisis shelter. So Amistad Crisis Shelter. We work with a lot of those youth as they are precariously housed. They're going from shelter to shelter, placement to placement constantly. So we want to provide them with independent living skills that can help them be sustainable on their own when they start to age out of the system. So Amistad provides services 12 to 17. It's a 14 to 30-day program. They can stay up there to 90 days. They do have to have a guardian sign them in. Casa Hermosa is more of the transitional living ages. So we have a transitional living service at Casa Hermosa, and they serve ages 16 to 21. Again, that are homeless, runaway, aging out of state custody. They really need a safe and stable place. It is a shorter term program. It's up to about 4 months unless they transition to the TLP program there, which can be up to a year. The Step Up Services, that's a new program for us. That's the transitional living for youth adults. This one is going to be housed in Rio Rancho. They have to be referred by CYFD, and their ages are 18 to 24, and also need preparation for living on their own. Those youth that are moving into Albuquerque would be the youth that Independent Futures would be able to support and serve once they move out of Rio Rancho. We also have our new community engagement program. We get referrals for this service from the county-funded crisis response program. And we also get self-referrals, but they do have to be self. It can't be a guardian, a parent, or anyone else making that referral for them. And we're working with them on crisis as needed for immediate intervention and linkage to other ongoing resources. Next slide, Stephen. Okay. We also continue counseling. So we can, once they discharge Independent Futures, they can continue with a counselor or come back for counseling services if they choose to. So we do a comprehensive mental health assessment, peer education, and individual family therapy provided by a licensed mental health professional. We have our youth support services, which we utilize a lot for aftercare from Independent Futures. It kind of just gives them that additional support, ages 12 to 21, to help them continue working on some life skills, education and career planning, relationships and communication. It just lets them know that they're not totally out on their own quite yet. They still have an additional support if need be. And then we have our street outreach program. This program provides a lot of referrals to Independent Futures. They are going out into the community and working with ages 12 to 21. So they're looking for those homeless youth out in the community, providing them with life packs, hygiene, snacks, bus passes, food boxes, clothing, healthcare referrals, a list of referrals or resources that are out in the community to help them. And then for those who are wanting to continue services, they're more than welcome to be referred to Independent Futures, where we can continue to help them find housing. And one of the programs I did not list on here was our rapid rehousing, which will now be linked also to Independent Futures. And with that, we're able to take up to 15 youth and place them into their own apartments with the assistance of that program's funding to pay rent, and also to get them linked into an apartment if they've been having problems getting an apartment to agree to lease to them. Okay, next slide. So for any further services, questions, referrals, our information is here. You can contact 212-7405 and make a referral, or ask about other programs that we may have, or fax us at 505-877-3533. Thank you.
Awesome. Thank you, Trish. And
sure.
That was great. Yeah, I'm really excited about it. I want to go back to the community engagement teams. Those are really, that's actually, can you speak a little bit more to that? Is that an alternative to law enforcement involvement? What would be the steps for that?
I can try my best.
Yeah, just real brief. I don't want to take too much time.
No, that's okay. So the community engagement team is supported by peer support workers. So they will be certified to be able to respond to crisis out in the community. The crisis mobile team would be the one that would make the call to them, and then they would be able to make connections with whatever crisis is happening and start working with those families. Typically, it's about 3 weeks, I believe. So they're able to do referrals for other services, crisis and safety planning, individual service planning, and mental health screenings. They also have accessibility to a therapist, and their services are 24/7. So my understanding, and correct me if I'm wrong, Stephen, but it comes through BCSO, is that correct? Referrals for the mobile crisis team, or is that something totally different?
No, I think this is actually through the fire departments.
Okay.
But I could be wrong too. Yeah, take that with a grain of salt. But I believe that's through the fire department.
It's a brand new program for us. We just started I think we launched it at the beginning of this month. We are staffed with 3 peer support workers and our MIS intake manager as well. So I think we still have some positions to fill, but we are up and running and making it successful. Tara Gutierrez is our clinical supervisor for that program right now as well.
Okay, awesome. Thank you. Yes. Yeah, let me go back to, there we go. So next up is Kelly Gilbreth, and Kelly, what does LPCC stand for? Licensed practicing, I forgot.
So basically it's the clinical counseling arm. So I know that there's independently licensed social workers, and then I'm an independently licensed clinical counselor.
Okay, all right. I just had LPCC, and I wanted to make sure everybody knew what that stood for, so thank you. Kelly Gilbreth is licensed, I'm sorry, what was it again?
Licensed professional clinical counselor.
Clinical counselor, okay. All right, I had forgotten. Thank you. So yes, Kelly is an LPCC, licensed professional clinical counselor, and is the director of clinical services at Crossroads Services for Women. And Kelly's going to speak to us today about a lot of the I shouldn't say a lot, some, because Crossroads, much like YDI, there's a lot of really good work out in the community, and it's impossible to really get into a lot of the details about a lot of the things they do. But she's going to talk to us about specifically the work that Crossroads does with us in the transitional living, the youth transitional living, and the permanent supportive housing programs today. So go ahead, Kelly.
Good morning. Thank you all for being here and wanting to really connect with the services that are here in Albuquerque. So I work again with Crossroads for Women, and we work specifically with women exiting incarceration. And so if you want to go to the next slide. So our mission is really to empower, to really create a space for women to feel like they can empower themselves, to create safe, healthy, and fulfilling lives, and to break the cycle of addiction, break the cycle of violence. So Crossroads began in 1997. There were two lawyers in Albuquerque who kept seeing women exiting from incarceration, but then finding themselves right back in incarceration, and really struggling with the fact that there was not a lot of services that supported them upon release of incarceration, and really looking to create a space for the community to really make a difference in their lives, just kind of stop that recidivism and try to really build a healthy future. This is the timeline of Crossroads. It began in 2000 with just case management services with 3 women. As Crossroads grew in 2005 is when we really began to open our first therapeutic community, Maya's Place. And so Maya's Place is actually one of the first therapeutic communities with Crossroads, where women exited directly from incarceration into a home-like environment and learned the skills of independent living. And then, we began to really work with the Department of Corrections, really trying to create more stability for our community. And then in 2016, we opened our second therapeutic community called the Pavilions, and that is in Los Lunas. And then currently, Crossroads has 3 specific programs. We have the 2 therapeutic communities, and then our Crossroads downtown program serves, right now, I believe we have about 84 women and children in their own apartments throughout the city. And so we provide comprehensive case management services to those families. And so at all of the programs, comprehensive day program. So really trying to create spaces for the women to gain knowledge and understanding around trauma, around addiction, and around healthy communication and healthy boundaries and healthy relationships. And so we, the day program is specifically the downtown program, but then those programming is also, that information is given to both the therapeutic communities as well. And we also strive to support the community to really identify what their vocational goals are, whether that's education, whether that's school, if they needed to get their GED or if they wanted to go for further education through CNM or UNM. And then also trying to identify what their goals are if they wanted to get some specific job training, really working to build out their resume, understand what their skills are and how to translate it to an interview format. And then we really look at building out that family supports as well. Some of our community, when they're released into the therapeutics, they really want to rebuild relationships with their family, really rebuild relationships with their children. And so we work together to help them create a really stabilizing force in their lives so that they can really work with whether it's CYFD or their families to become the parents that they want to be. And then we also have a really vibrant aftercare program. And so any client that has graduated or kind of moved on from Maya's Place or Pavilions or even Crossroads, we feel like they're always part of our community. They're always part of our family. And so I believe about 4 years ago, we really built up our aftercare program. And so it's really on the foundation of peer-on-peer support. So we do have a lot of peer support workers that support our community. So women can come in if they're needing just to meet with someone, or if they're needing some support, on interview skills, or needing some support on how to work with their landlord, they can receive that support through our aftercare program. We have also, in the time of COVID, built out 2 other programs as well. So what we were finding is once they received a lot of the supports from the therapeutics, there was kind of a gap in services. So once they released from the therapeutics, it was a difficult time getting back into independent living from a community for so long, and then trying to figure out how to do it all on their own. So we built the Step Up program at Crossroads, which really supports the women for about 3 months with some rental assistance, so they can kind of get that stability and figure out their budget and try to figure out what do I need each month to maintain my independent living. And then we also have a specific a home that we work with we call it the Bellama House, because that's kind of the community. And so when there are women that are directly releasing from the therapeutics, they can apply to go into the Bellama, which is another small community living with 3 or 4 other women, to get stabilized with their job and get enough money saved so that they can move out on their own. And we have a working relationship with corrections. At both of our therapeutic communities, we work with the Department of Corrections. And at Pavilions, there's actually one identified probation officer that works with the community itself. And so we really, it's definitely, I feel like it's a working relationship. I think that sometimes it's hard because we come from 2 different perspectives, right? There's corrections, and then there's therapeutics. And so how do we meet in the middle? And how do we always come from a place of empowerment and choice? And so this is the makeup of our community. Again, 100% of the women that we serve have been involved in the criminal justice system. The majority of our women also have a PTSD diagnosis, usually complex trauma, resulting usually in childhood, and then situations of domestic violence that also appear in their lives. And there is a dual diagnosis, a co-occurring disorder situation where there is a diagnosis of maybe PTSD, a major depressive disorder, possibly bipolar disorder, and then in conjunction with a substance abuse diagnosis. A lot of our community falls in the range of 18 to 70. And so we do have a wide range of community that we serve. Over half of our community identify as women of color. And again, 90 to 95% of our population fall below the poverty line. And about half of our community have children. And so we really, the foundation of our services come from a trauma-informed practices, really how to really acknowledge that anybody walking through our doors, we have to have a mindset that they most probably have experienced some form, if not many forms of trauma. So how our first goal is to create a space of safety. And so we really try to do that within our community, our staff, and also really come from a place of how does a trauma-informed practice affect our relationship in the present moment. And what we have found in our work is that focusing on 7 areas, or we call them the 7 domains, is so important in terms of stability. So we really try to support our community to get stability in their mental health, stability in their issues around recovery, stability in that vocational realm, whether it's education, whether it's a job acquisition, whether it's applying for Social Security, whether it's community service. We also recognize that getting stabilized with their medical needs is so important. Wanted to get there to a place where they're off probation, off papers, so that they can really learn those independent living skills and kind of make sure that they are creating stability in their own home. Re-engagement with family, building that social structure. One of the main foundations of Crossroads is that we want to make sure that they have as many systems of support as possible. So we do link to other services, link to outside counseling, link to NA groups, anything that's going to really support them in their recovery and building that stabilizing, healthy life. And then those independent living skills, really just supporting them to, at the therapeutics, it might look like getting a driver's license or getting their primary care doctor set up, or whatever it is that going to help them to be able to live independently. And so again, trauma-informed, gender responsive, right? We always want to really acknowledge that the systems are different and the needs are different based on your gender. And we really focus on harm reduction. So at the 3 programs, harm reduction looks different. So at the therapeutics, it is not a full harm reduction model because we do maintain the safety of those therapeutic environments. And so we do not work with medicated assisted treatments such as methadone or Suboxone at the therapeutics. However, at the downtown Crossroads, our community is in a wide spectrum of reaching their recovery goals. And so many of our community have found for themselves medicated assisted treatment is really helpful in terms of getting stability in their lives. So we do have community that have chosen to receive methadone or Suboxone to create that stability in their worlds. And that wraparound services, right? The goal of working with a client who is releasing from incarceration, stabilizing in that community space, kind of helping them to get independently stabilized in their own apartments. And then at the end of the day, we have services and groups that they can always connect with, and they can always receive support with a case manager, just by walking in the door or giving a call. And those guiding principles of trauma-informed care is really the goal. First is to create a space of safety, that peer support, right? Mutual self-respect and self-help. building a system of trustworthiness and transparency. We feel like I've never used the word transparent more in my life since working here at Crossroads. We strive to really always be transparent, clear, letting people know the steps, letting people know what the expectations are. What are your expectations of us as a program? What are our expectations of you as a community member? And really, again, building that collaboration. And so how we can really recognize that we are responding to the fact that our community comes with trauma experiences. And so we want to strive to create a safe environment, a culture within our organization that we acknowledge that we don't want to be re-traumatizing anyone, right? We want to be really mindful that everything we do, we want to decrease the amount of traumatization. We see that also in our values, empowerment, choice. Again, we're creating a space for our community to be empowering themselves. I always say, like, we're trying to work ourselves out of a job, right? We want to give a space for our community to learn the skills and learn their voice and learn their goals and what they need so that they could lead the life of their dreams. And then creating spaces of leadership, right? We have so many community members that have started as clients. They're very vocal about their own road towards recovery, towards health. And so it's so empowering to see that peer-on-peer support, really how their community supports one another. And we see that so vibrantly in the groups that we run. I never, I always feel it's so powerful when another community member can support each other, right? And we're just kind of creating that space for that connection to occur. I know that in COVID, we've really had to do a lot of virtual groups, a lot of virtual Zoom things, experiences, and connecting that way. However, last Monday, we had our first in-person group again. So we're really excited to be part of connecting in person again. So we're excited to create that space in our new building and to really see how the community really supports one another. And again, our tagline really is breaking cycles and building lives. And I want to really come from that place of empowerment, right? The community themselves is breaking their own cycles of violence, their own cycles of addiction, and building their own future and their lives.
Okay, great. Thank you, Kelly. That was a good job. And I just had to tell you, I want to go back because I really liked that picture right there. That was a great picture. You know, you can see the compassion there and the love they have for each other. So yeah, a lot of great pictures. Okay, next up, we'll have our final presenter with Leonette Archuleta, and she's the supportive housing program manager with Bernalillo County Housing Department. And Leonette is here to speak with us about the Community Connections Program. And that's a permanent supportive housing program. And it's paired with intensive case management. And it serves what we call a targeted population of homeless or precariously housed individuals, which you've heard before in some of the other presentations. And again, with mental health or co-occurring disorders. And this unique program is a collaboration between the Bernalillo County Behavioral Health, Housing, and then the city of Albuquerque. And it really demonstrates how effective local government partnership can be in collectively addressing what is a significant community need. So I'm going to get to Leonette's slides, and then Leonette, thank you for taking the time, and go ahead and take it away.
Well, good morning, everybody. And Stephen, thank you for that introduction. I think that you took care of my first part of my my slides for me. Thank you.
I did not mean to steal your thunder.
No,
I'm sorry.
We're a collaborative program, so just wanted to Steve and Kashif, we work together. We're as Stephen spoke, we are a collaborative program. Community Connections is a collaborative program between Department of Behavioral Health, Housing, and service providers, which we contract with, which include UNM and Crossroads. So as it was spoken on the previous presentation, we do work in connection with Crossroads, which they provide some of the case management for some of our participants. And I think it's okay for you to go on to the next slide, Stephen. So as he was speaking, the clientele that we work with is, we work with the population of homeless or precariously housed clients with mental health, illness, and or co-occurring disorders or other disabilities who lack in community-based services which have resulted in numerous contacts with the criminal justice system, such as MDC. So a lot of our clients are coming out of MDC and or have been frequent utilizers of the emergency room. So any emergency services. So what we do is we link them to case management services and bring them out of homelessness to be able to become self-sufficient and live independently within our communities. And with the help and guidance of our service providers, UNM and Crossroads, they help with stabilizing our clients and working with them and teaching them those skills to be able to live independently. Next slide. So referrals. So to our program, one needs to have a referral. One cannot be self-referred. So they can be referred by Metropolitan Detention Center, MDC, any community resource agency out there working with individuals within the community, and or hospital or medical professionals. We will take referrals from all these agencies. Next slide. Qualifications. So qualifications to our program, of course, one must be either homeless or precariously housed within Bernalillo County. They cannot be out of the county of Bernalillo. So all their homelessness and their qualifications for the program must be within Bernalillo County. Our program is funded through gross receipts tax through Bernalillo County. So that's where we meet the qualifications of the program. One must have mental illness, substance addiction, or behavioral health condition. One also must meet the area median income of 30%. And of course, one or the other, like we said, incarcerations to MDC and or emergent services. Next slide. So to go into a little bit more depth on the qualifications, so one would need to meet 2 or more inpatient hospitalizations in a 12-month period, or 3 or more behavioral health related encounters in a psychiatric emergent service, PES, or emergent department in a 6-month period of time. And this is just one, they only need to meet one of these criteria, okay? So the next bullet is 1 or more admissions in a 24-month to a county behavioral health service program, service aftercare or detox program. The next bullet is 3 or more bookings at MDC in the last 5 years. One must be in a PAC unit. Next slide. So referrals can come to us by email, fax. They cannot be submitted by the individual themselves. The referrals must be able to live independently. This is not we just want to ensure and reaffirm that we're not a 24/7 supervision in this program. Some of our case managers, they're on 24/7. We do get calls from our clients that are on the program on weekends, and some of us do work and we do pick up our phones. So even though we say that we're not a supervisional program 24/7, we do have that connection with our clients that we do tell them, if they have any emergency, of course, call 911. But if you have any questions, you can call us after hours or on the weekends, and we can get them connected to the appropriate person. So this is a long-term supportive housing program. Appropriate referrals would not include individuals who are sentenced into long-term MDC or Department of Corrections. So ones would not be able to be referred. If they are going to be incarcerated for a long period of time, this program would not probably fit for that individual because it's a long-term supportive housing program. Applicants who are referred will get placed on a waiting list. And according to budget, each of our contracted numbers between UNM and Crossroads, then we would lease up to budget and to their contractual numbers. Right now, we're serving about 240 clients within our program, and we're hoping to grow this even larger, probably within the next 6 months to a year. You would see our programs grow within our service providers, and serve hopefully up to about 325 clients. So even though it seems small, a small amount, to us, it's a big dent within our community that we have taken these 200 and some now, in the future 325 clients off the streets of Bernalillo County, and provided them with safe sanitary living conditions within our community. Next slide. So for any referrals or information regarding our program, this slide shows me, Lynette Archuleta, Supportive Housing Program Manager. My phone number is 314-0217. My cell phone number is 220-6536. And you can reach me at sarchulet@burnco.gov. For any information, you can contact myself or my staff members. I have Jennifer Ramos, who is Supportive Housing Intake Coordinator, and I have Roberta Garcia, who is Supportive Housing Intake Technician, which she is our HQS inspector for the program. So again, any referrals, they can be submitted to us by email or fax, mailed in. Our address is 2400 Wellesley Northeast, Suite 100. The fax number is 462-9737 if you wish to fax the application. And I think that'll do it. I think I have staff on if you guys all have any questions.
Awesome. Thank you, Leonette. And one thing I wanted to ask Leonette, and what is PAC? You mentioned PAC and there.
So it's the psychiatric acute care.
Okay.
That's the certain unit within MDC.
Okay. All right. Thank you. Yeah, I remember us talking about it, but I had forgotten what that was. So thank you.
Yes.
So yeah, we can open it up now to questions for anybody. You can either type them in the chat box or chime in. I know I had a couple of questions too. And I guess while we wait for people to either chime in or type it in the chat, and we can do this, we can start with a specific individual, I guess, but one of the questions for me was whether your program, what impacts you've seen on your program as a result of the recent, COVID-19, and what your thoughts are on any of the long-term impacts of the pandemic on behavioral health. And so I guess we can start with Leonette, since you finished. Do you want to? I think Kelly's Shelly's texting me that her computer is frozen. So have you seen any impacts on with COVID-19, Lee and Ned?
Yeah, with COVID-19, we're seeing now that a limited source of units available out there. You know, COVID-19 at the beginning, we didn't see that. We're seeing that a little bit more now. We're anticipating that the eviction moratorium, as it expires, that maybe we may see a little bit more inventory out there for our clients. So the difficulty has been locating of units. And then maybe a little bit of us, you know, not being able to engage within our community, within, you know, with the landlords, and getting more units out there available, you know, getting the word out as to what our program is, how we have case management attached with our program participants, you know, so we can engage them within our program just to better serve our clients that way. And give them a wider spread within Bernalillo County, and not just those lower impacted communities within Bernalillo County. Give them the wider variety to go to different areas within the city. So and I'm hoping that hopefully as COVID is ending, that we can work with some of our landlords out there and get the word out and get more participants on our program to work with our clients.
Okay, how about Trish? Trisha, have you seen, what are the impacts you've seen with coronavirus?
The major impacts that we saw are the youth that we do serve. They were needing a little bit more attention and reassurance. They needed things to kind of help stabilize them through the lockdowns and not being able to get out there and do their normal things. So it took a toll on their mental health for sure. But we were luckily allowed and able to provide them with certain resources and items to help entertain them during these difficult times. And our staff were still able to meet with them virtually or over the phone as often as they needed. Another impact that we saw was really just that communication with our community. We found new connections, but we really struggled with making contact with other community providers out there, just because of no one was in the office. It was a lack of communication due to people not being there, not having immediate access to computers and phones and so forth. So I think that was a big toll on getting referrals and being able to really connect with people out in the community again.
Okay, have you guys seen any positives? I know on my end, I think some of the positives are, like, one of my frustrations with our system is nobody really wanted to use things like telehealth or any of those things. And I think, that's one positive out of the many negatives. But I think there's a little bit of an increased willingness to use telehealth or things like that to address these issues. And can you guys think of anything on your end like that as well? There was a positive impact, or not an impact?
Definitely what you're saying, Stephen, is true for us as well. A lot of our staff were able to utilize the computer in ways that they weren't educated to do before. So it's really brought out their skill set. And our clients as well. It's helped them to kind of come out of their box and really continue to do things. We've still had a lot of successes in our program. Youth have finished going to school, even though it was through pandemic. So we've had a lot of positives on that end. Another positive I would say is that we did have connections with other places that we hadn't had connections with, especially with food boxes. We made a lot of community connections with churches throughout our community, other storehouses and so forth, to help get our youth food boxes and help them through that difficult time. So I think those are some positives.
Nice. How about you, Lee and Ned? Is there anything you would add?
Yeah, I think the positive that even though we have faced a lot of barriers during COVID, that we have still been able to house quite a few clients and still work remotely with them, even though it wasn't our norm. Like Tricia said, it's, getting them out of their box and getting them used to another way of communicating, which we were able to successfully do with our clients, and we saw our numbers jump. So those numbers never declined. So I think that is totally a positive thing, that we were still able to overcome these barriers and house clients within our program.
Nice. Yeah, I'm I know on my end, I'm hopeful that some of the more rural communities out there in New Mexico can continue to use some of these, the technological innovations that we all had to get on board with. So hopefully this has a positive impact in that direction. That's my hope anyway.
Right.
And so one of the things that another question that I had was, we've been in, I guess, BHI, the Behavioral Health Collaborative, or the initiative we've been collaborating with community partners since 2014. And as we continue to move forward, what are some of the significant barriers or the challenges that you've experienced at the community level? Things like community resistance, or changing in any of the issues, substance abuse, anything you can think of that were significant barriers in providing support to Bernalillo County. And we can go ahead with, I guess, Leonette, why don't you go ahead with that one?
Yeah, so some of the barriers that we have, unfortunately, during COVID, we've seen, a higher level of substance abuse, relapse, and but the connection has always been there with their program case manager, with the service provider. So they have gotten the great service there. It's just connecting. The difficulty was connecting them to either a long-term rehabilitation center, since they were not accepting inpatient clients. Everything was, like you said, during telehealth, and doing a lot of their programming through virtual, which a lot of them didn't like doing that. They didn't feel like they were actually connected. So we saw a little bit of that during COVID, which we anticipate, this may be a way of the future, that I think there was a step to, COVID gave us just that incentive, or that step to work towards a lot of virtual. So maybe it'll, help us to assist our clients in working with technology, and the case management working with technology. So that was some of the barriers that we saw, some of the relapse that we saw due to the stresses that COVID has caused.
Okay, thank you. Tricia, what were some of the barriers that you guys have experienced? And these do not have to be COVID related, just, anything even bigger than that.
I think our major barriers were, we work a lot with the school system, and not having our youth in school, attending classes, and not having easy access to the administrators made it difficult. And I feel like a lot of the students that needed services weren't able to, or weren't even aware of services that were available to them within a community. I think that that's a huge barrier, is that these students this year just didn't know what was there to help them, and who was there to help them, and where they could go. I don't know if that was a focus that APS had at the time, or that charter schools had at the time, but I think that's definitely a huge barrier. I think I kind of went over it a little bit, the barriers our youth had were really struggling. They were just having a hard and difficult time occupying their time and finding things to do. We had some that had layoffs. As of now, most of them are employed, which is awesome. But during the actual hard hit of COVID, they definitely struggled with keeping jobs and maintaining jobs. And so that was difficult for them as well. So I think those are some of our barriers that we saw. As far as an agency, we pretty much just kept moving forward. We left here for 2 weeks with the intent of coming back within 2 weeks, and grabbed our computers and started working from home, and we didn't really miss a beat. We kind of just kept going. And so that's also a positive.
Oops, sorry, I was on mute there. Yeah, and I think that is an interesting note, that when this began, it was 2 weeks, and then 2 weeks turned into 2 months, and then 2 months turned into 6 months, and we've all had to make those adjustments. And I guess for me, has either one of you seen a change in, I guess the way I'm thinking of it is, a lot of the substance abuse that we see out in the community is a coping skill for trauma or for the situations that people find themselves in. Have you seen any kind of change in the substances that clients are using during COVID, or an increase in substance use during COVID as a coping skill?
I think within our program, it's been about 50-50. We've had youth who have been working on sobriety throughout being in our program, and they were able to maintain it during this, which was a huge success. And on the other hand, we've also had youth who have gone into using substances. Nothing too hardcore, but still a struggle. I think our case managers have done an awesome job with keeping that communication going with them, providing them with resources, providing them with that extra attention, and just really items to keep them busy. Puzzles, tablets, games, crosswords, coloring books and pencils. We really try to focus hard on what can we do to cope in a better way and provide them with some of those skills. And then also offer counseling and therapy to them. So for us, it's been probably, I would say 50-50. There's a lot of them have remained sobriety, and a lot of them have struggled.
Thank you. Leonette, have you seen anything like that on your end?
Yeah, it's been about 50-50, the substance abuse. And like I was mentioning earlier, it's been hard for them to get connected to, and they don't want to do virtual meetings or the telehealth. So it's been about 50-50, but we're seeing that ones now that we're starting to open up after COVID, they're starting to re-engage within those services, community services out there, and really work on getting back to sobriety and the want to getting back to sobriety. It's funny with our program throughout the year, as seasons change, we see that change within our clients as well, at each season. So not only does it happen during COVID, our behaviors of our clients change with the season. It's quite funny how it happens, but we just get them reconnected, re-engaged with case management, work on those services that they're needing. And case management has been, really great at engaging them and connecting them with services within our community that they're unable to service them with. So our main focus with housing, like I said, has been, re-engaging and getting them connected so they're stable and self-sufficient to be able to live independently within our housing program. Because it is a collaborative program, they have to have case management in order to have their housing voucher. In order to have their housing voucher, they have to have case management. So they work within the same. So if you don't have one, they don't have the, they won't get the other, and then they will not be able to be a participant of the program. So we work really close in hand to engage the clients on both ends.
Awesome. Yes, I can tell everybody that, you know, there's a lot of work that wasn't covered, but housing, Crossroads, you know, and YDI all do a tremendous amount of work behind the scenes to implement the programs and all the, you know, that they are implementing and all the support services that go along with that. So absolutely. And I didn't see any questions come up in the chat. And so, unless there's anything that we want to cover, we are almost out of time at the end of our allotted time anyway. So was there anything else that anybody wanted to chime in with before we end it? Okay, if not, then everybody, thank you, Trish and Leonette, and Kelly had technical issues, so she had to drop off, but I'll shoot her a thanks too. But I really appreciate you, all the hard work that both of you do and your organizations do, and you know, the partnerships that we have to help people in this community. I can tell you that the community would not be the same if you guys weren't here doing the hard work that you do. So, and I appreciate you guys stepping forward to help us put on this webinar, and we're hopeful that, you know, as hopefully we go back to air quotes normal here, that next year we're going to be a little bit more, you know, back on track with doing May Mental Health Month as we used to do in the past. So, but I appreciate you both showing up and providing us your expertise and all the hard work that you both do.
Thank you.
Thank you. You all have a great day.
Okay.
And thank you, Stephen, for everything that you do on the behavioral health side as well. Tricia, thank you for your services.
Thank you as well.
Okay.
All right. Bye-bye.
Take care, everybody.